My name is Dr. Colin Booth, and I am a spine surgeon at TOE East Tennessee. And what you're about to hear is a testimonial from one of my patients who had a 2-level disc replacement. She also happens to be a coworker at TOA, so I've known her for a while. And she presented to me a few years ago with neck and mostly right arm pain. She tried all sorts of non-operative treatment, dry needling, massage, stretching, cupping, and none of it worked. And then so we started walking down the surgical path together and ended up deciding that the disc replacement was the right answer for her. The process of doing the disc replacement, it's not brand new technology, but within the past 15 to 20 years, it's starting to become more prominent, particularly for patients like Kristy, very active, young, not wanting to lose any range of motion or function that could be detrimental later on in life. So we decided on the disc replacement. And the process of doing that is very typical to a normal neck fusion. We go into the front of the neck, which sounds scary because there's a lot of scary stuff there. But there's a natural plane that God put there that we just kind of move everything aside. And then we go in and take out the bone spurs and the disc. Instead of putting a device that fuses the bones together, we put a device that maintains motion. Not only does it maintain motion, it also takes the pressure off of the nerves. So you get the same benefit of a fusion, which is good relief of nerve pain, but you also maintain range of motion. Most of the research shows it decreases damage to the other levels, decreasing risk of surgery in the future. Recovery is shorter, and the outcomes are great. So thanks for stopping by, and I hope you enjoyed the testimonial. And we are here today with a patient of mine, Kristy Parker. And I think we were talking before, it's been, 2 years now?
Yes.
2 years.
2
and
years.
Why don't you tell our audience what happened?
Well, let's see. I think I'd have to go back at least 10 years to the beginning of my serious symptoms.
Yeah. And what were the symptoms?
Constant neck pain. Constant. Yeah. Spasming, inability to really kind of rest, like get my shoulders back, get comfortable. And then it started to progress, and I started to have a lot more arm pain going on, particularly. First, it kind of started in my left arm, and I was like, oh, maybe it's my shoulder, maybe it's this, and then migrated to the right arm as well, and then just sat in the right arm, and in particular the bicep area. And honestly, I thought it was my shoulder for a long time. I thought, well, I have a horrible neck. I already know that. I've seen multiple doctors at TOA. I have a very straight neck with
you do.
No natural curve to it. So I know. And but I didn't realize, I don't think, I had an idea that some of the pain was coming from my neck. But I thought, well, maybe I had an old shoulder injury. Maybe it's some of that. And
did you have your shoulder injected before?
I did.
Did it help at all?
No.
Yeah.
Let's see. I did injections.
Yeah.
I did massages. I don't know how much money I've spent in massages. I did cupping.
I've had that. That hurts.
Yeah. It is kind of painful.
It's very painful.
I did the professional stretching thing.
Oh, did you go to the place in Bearden?
Yep.
Yeah.
Mm-hmm. Did that.
Yep.
The needling.
Mm-hmm.
I tried everything.
Yeah.
Tried everything.
Nothing. Now, when you came to see me, you tried all that stuff, and we, through imaging, we knew it was majority was coming from your neck. Mm-hmm. The injections, the epidurals in your neck, did they help at all?
No.
Not for a little bit.
They really didn't.
Yeah.
And I don't know why. I did try them a couple of times, but they didn't really.
Yeah, and sometimes they do, sometimes they don't. But we always try to avoid surgery, and you were trying to avoid. You did everything to avoid surgery, and but we talked, and with the disc replacement, someone your age, active, not terrible arthritis, so disc replacement is a good option for you. So we talked about risk, benefits, and everything, and decided that that's what we would do. So on the day of surgery, we did it in the surgery center. Mm-hmm. So can you kind of walk people through like kind of what the lead up was like, any nerves, any apprehension, like what the day,
I was very nervous. I was
As you should be.
extremely nervous about the whole thing.
Yeah.
But I actually got into a point where I was like, this is it. I don't have a choice.
Yeah.
If I want to actually live the rest of my life and be present for my family, for my daughter, be the person I need to be at work and so on, I need to do this. Like, something has to happen.
Yeah.
So I was really, it's kind of like, when you're jumping into the deep end of a pool, that's kind of what it felt like.
Yeah.
Like, you just grab your nose and just jump.
Yeah. That's
what it felt like. And it was that day at the surgery center, though, you're going to laugh when I tell you this. So we've known each other prior to the surgery.
Yeah.
And when I go in there, I felt like you all thought maybe that I knew what was going to happen next, was the funny thing. It was almost like, oh, it's Kristy, so on and so forth. And I'm trying to be cool about it. I'm like, yeah, I know what's going on. It's fine. It's cool.
This is great.
And then going back into the OR and getting on the table and stuff, I was just like, it was like that feeling like you're getting on a roller coaster, and which I don't like roller coasters, but you get like.
But you can ride it if you want to.
No, I won't do it.
Oh,
I will not do anything to mess with my neck.
But you can
point.
If you want to.
I know, but I'm so thankful that I just am like, don't leave my neck alone. But getting kind of jumping into the deep end of the pool or getting on the roller coaster, that's what it felt like. But I was resolved to it. Yeah. I was like, this has to happen.
You did everything you needed to do. And, we had long discussions about this, answered the questions, and, felt very confident that this was going to help you. And, I mean, when you woke up, did you notice any immediate difference?
I didn't. I had a nagging arm pain right about here, and it was constant. And I had it for probably 2 years, constant, like a toothache.
Yeah.
And I didn't feel that when I woke up.
When you immediately woke up, that was gone?
It was gone.
It's awesome.
It was gone. And then I went home, and you told me to walk as much as you can, as much as you can tolerate, walk. And that'll help, like, loosen up the shoulders a little bit.
Keep you moving.
And so I did that right away. And I kept waiting for that pain to kind of come back in my arm. Like, I was kind of like, well, maybe I didn't want to get my hopes up too high, Like, is it the anesthesia? Is it the pain medicine? Is that why I'm not feeling it? And so I keep monitoring this throughout, like, the next couple of weeks. And every once in a while, I might get, like, a little ping of something. Yeah. Like, just, your nerves, they're trying to settle.
Yeah. They remind you that they're there.
Is it coming back? But no, it didn't. It didn't. It was gone. Yeah. And from there, honestly, it just every day got better.
Awesome. That's awesome.
Yeah.
So, in general, though, how was the recovery? Was it worse than you thought it was going to be? Was it better there? Was it about what you thought it would be? Like, pain-wise, activity-wise?
Oh, it was easier than I thought it would be.
Okay.
Yes.
Yeah.
I think I recovered faster than I thought I would.
You recover pretty fast.
Yeah.
Yeah. Actually, I mean, the disc replacements in general usually do.
Yeah.
So
yeah.
You're a good testament to that.
Yes. So. Yes. And I'd listened to you, and I did everything you said to do. I did my walking. The walking, I think, was the most important. I would just go out and walk.
Yeah.
And so I did all of that, and I think I only missed a couple days of work. And
that's impressive.
Working from home.
Yeah.
Maybe 3 or 4 days after that, and then came back into the office, and everybody was looking at my little incision like,
you heal great.
How, can't even, they're like, I know. For the first couple of days, I had like a giant bandage on.
It looks ugly.
I just didn't want to freak anyone out. Like, you know what I mean?
Yeah.
Like, it didn't bother me. I didn't want to freak anyone out, though. So I just did that. But no, it was great. And then.
And you've been doing things you want to do and working out and obviously not riding roller coasters, but.
I didn't ride them before either. Okay. So that's okay. But I I was able to get back in the gym. Lost some weight, getting back into the gym, and getting my muscles built back up again, getting my metabolism restarted. So that was fantastic. And I think I told you this story, like, it was a couple months later. And one of the things that I always dreaded when I was dealing with the chronic pain was getting on an airplane. because, when you're sitting on an airplane, you're sitting like straight up like this.
And your head's kind of tilted forward. It's just,
head's tilted forward. And I was going somewhere for a work trip, and I got on the plane, and I literally just sat there for like an hour, just staring off into space. Like, I cannot believe I'm sitting in the seat and I am not just in agonizing pain.
It's impressive. You make airplane travel more comfortable.
I know. And so it's moments like that I'm like, oh, gosh, the only thing I wish is I had done this sooner.
Yeah.
So
it's a common thing I hear, but and I always tell patients that you made the right decision for you at the right time. Because it's not a decision to take lightly. I mean, I know you had a lot of concerns, and we talked about them, we got through it, and you did it when it was right for you. And only the patient knows when it's right for them. And so, I mean, obviously you've done well. I mean, would you do it again?
Yes.
Good.
Yes. Yeah. I think I've already actually said that to you. Hey, if something else happens during my tests, just so you know. You have. No, everything's great. It's amazing. I haven't lost function. I mean, I have full range of motion. The only thing I could possibly say is if there's a TV up high, like at a bar or something, and you try to look up at it, after a while it gets a little tiresome. But that's it. Yeah. That's it. And I'll take that all day long.
Well, good. Good. So I really appreciate you stopping by and, giving your testimonial about this procedure and how everything went. So if you are having issues similar to Kristy and like to have someone evaluate your neck and see if disc replacement is right for you, please give us a call at East Tennessee TOA. We'll be able to take care of you. Thank you.